Hey, welcome back, everybody, to Telemedicine Talks. I'm super excited to have this guest on. Been looking forward to having her on for quite a while. This is Dr. Nancy Sharma. She's a board certified medical oncologist licensed to practice in all 50 states with over 15 years of experience in oncology and hematology. If you didn't know, she's been the past 4 years the top doctor award in Seattle Magazine and actually started her own telemedicine company called Thrive Integrative Cancer Care, which we're going to delve a little further into. But before we do that, Dr. Sharma, welcome to the show. Super stoked to have you on. Thank you for being here.
Thank you so much, Leo. I'm very, very happy to be here as well. Thank you.
Yeah, no. So I know we've known each other now for it's been a while since the start of our telemedicine journey. I think we started our telemedicine
Right.
journey together. And it's been awesome to see you grow and add and do things. And I know since you started, one of your main goals was to start your own telemedicine company. And so
Right.
now it's nice to see it realized. And so, well, tell me about really how you started in medicine and then how you started into kind of your own journey. Yeah, how you started Thrive and how that came to be.
Yeah, thank you for asking that. I think so. My journey into medicine was more like natural process. My dad is a physician. My grandfather was a physician. So they had their own practices and I would go with them. And I really loved the way they connected with their patients and kind of was a no brainer. I think I felt that I fit in that role. And so I worked hard, and I think with the guidance of course, my dad too, things went well. For oncology, it was a little different journey. I kind of went to different other specialties and thinking about what I wanted to do when I was in internal medicine. So when I came to US, I got interested in, gerontology and more like in geriatric population medicine. I participated in some policy, learning about how nursing homes work. Kind of, it gave me a segue into hospice, and I did some work there. And I felt really connected to this patient population. At the same time, when I was doing that during my earlier years in US, my grandfather got diagnosed with multiple myeloma. And I was, of course, being a physician, very intrigued. And so I took some time off after my gerontology master's. We went back to India, just to be, with the family. And I didn't know what I wanted to pursue more. And so I walked that journey with him for some months. He passed away rather quickly, but it kind of left kind of a void in me to know more about why this happened, what is cancer, why it's like causing so much agony. And more than that, I think I was also touched by the side effects of treatments
Yeah.
and whatnot. And I felt that somebody needs to do something better.
Yeah.
I was very interested in research at that time. I did some research when I was in Chicago in oncology. And once I got into residency, I kind of pursued that. I wasn't very sure because a part of me knew that this is going to be a very all involving
Yeah.
field. You get to know your patients and you're walking with them in this journey when they are really very down,
Yeah.
and somebody needs to help them, but it can affect you as well. And but I think the more I did it, I felt very drawn to it. And I was very sure during this, after the second year, after I finished my oncology rotations, bone marrow transplant units, that I wanted to do oncology. And because I was doing a lot of research earlier on and then during my residency, it helped me get into my oncology program. It was a very empowering experience during all this. I was always fascinated. One, because of my what happened in my family and how things were going with my grandfather. I was always very intrigued by how we can help people to mitigate their treatment side effects. And if people would come to me about, okay, my naturopath has given me this medication, can I take it, or
Yeah.
can I do acupuncture? And I'm like, initially I was like, yeah, you could. It's not affecting, but slowly I was like, I need to know more. Is it really helping these people? And when I came to Seattle, I saw that a lot of people were wanting to have an alternate segue. So then, with all my training in oncology, where I wanted to treat people and a lot of them cure, I mean, these medications can cure them, and but then they have a lot of side effects, and
Yeah.
then people are wanting to do something different. It was a point where I needed to make a decision whether I'm going to get more information about it so I can guide my patients, or I can just wash my hands and say, hey, I don't know. I don't think you should do it. There's no benefit.
Yeah.
So I started, reading a lot, especially during the last, I would say, 6 years. I have been allowing a lot of my patients to use alternate medication. I think it helped them because they were becoming more comfortable talking to me what
Yeah.
all they were doing and taking, and then I could make sure they were not running into polypharmacy, right? They're not
Yeah.
taking like a bunch of things which may interact with their treatments. And I did notice that people who delved in some alternate ways of helping themselves during their treatments, they did better. They were more active, they had less side effects, they, for whatever reason, I felt were kind of beating the conventional research, the time frame,
Yeah.
right? Like
Yeah.
you say, okay, you have this kind of cancer, okay, you're going to live like, okay, maybe a year. I mean, things are changing, of course,
Yeah.
in oncology front with immunotherapy. Things are really, improved. People who were living 6 months are living more than 5 years and whatnot. But even in cancers where we don't have a lot of headway yet, where I would be like, okay, I don't know, this cancer has
Yeah.
spread so much and you may die in like 6 months or 3 months. I don't know. But some of them really surprised me. They were so determined to go and do whatever could help them. And that kind of just opened my world towards it. And I did some training, I did Institute of Functional Medicine training, and that kind of also helped me look into disease in a very different light. Like
Yeah.
it is not just, how I can fix this. It's all about like why do I have this
Yeah.
in the first place? Now, cancer is a disease where nobody wants to go. And the first question in everybody's mind is like, why me, right?
Yeah.
What did I do wrong? Or what happened that this is now affecting me? Of course, a lot of time, personal choices, and how you manage your stress levels and whatnot. And life happens to everybody, and people just go through things, emotions, and without consciously realizing where to take a pause. And I think that kind of motivated me to kind of do something about it. I made, some protocols, and then in the meantime, I think there were other oncologists around the country also getting interested in this integrative medicine approach. A lot of major institutes, MD Anderson, for
Yeah.
example, City of Hope, they are opening integrative oncology departments. They know that some of the alternate medications need to be tested much more than, and not just brushed aside. Yes, we cannot tell people yet that what can, if there are any alternate ways they can cure their diseases,
Yeah.
and but at the same time we know that a lot of nutrition, lifestyle, they do help people live longer, and why not cancer patients too? So uh, that was the inspiration. And I think when I'm doing this now in my own business, I can see people feel much more supported. I
Yeah.
think they feel, they're not alone in this. And then secondly, they have measures which can be taken, which can help mitigate their, treatment side effects, both short term and long
Yeah.
term,
Yeah.
which is huge. It is all about quality of life at the end of the day.
I think several points that you made are amazing. So first of all, you're correct. I think hematology and oncology, how you mentioned that, yes, it's a very involved specialty, right? It takes a very special person to do it because you get involved too. I remember doing my pediatric residencies. Really, the patients that I remember the most were the hemonc patients because, yes, I was part of their family day to day. I saw them multiple times during my residency. Shoot, I get Bruno, Laura, I can name the names and remember their
Yes,
faces,
yes.
right? And
Yeah.
still follow them on Facebook. They're grown. But this is the most touching patients that I've been. So, yes, thank you for doing what you do because medicine is physically demanding, but this is also emotionally, spiritually, and just wholly demanding. And I think it's also amazing that you mentioned that, you had a choice, a point in your career where you could have taken the hard line and said, "Hey, this is not science, quote science," right?
Right.
Or the approach instead you took was like, "Hey, maybe there's something with this. This is not traditional, Western medicine. This is not what we learned in medical school or even in residency." But, you had the wherewithal to know that, hey, these people are getting better, for worse, right? Or these people are getting better for different reasons. Is it actually the medicine or is it their involvement or both? And you've delved into it. And I think, and now what you're telling me is that, yes, there's these bigger set entities, MD Anderson, so forth and so on, that when you say their name, people listen, right? And if they're
Right.
doing it, then of course it validates what it is, right?
Right.
So that's amazing. Yeah, congratulations. Now, and so how are you doing that in your company and now in the telemedicine space as well? A couple questions. Do you see any difference with what you're doing with what you can do in telemedicine versus what you could have been doing in brick and mortar? And is there a kind of a different approach or what benefits do you see, with your company Thrive?
Yeah, I think that's a great question. So Thrive is right now only like telehealth company where I'm
Mhm.
only seeing patients, um, via audio, video, visual channels. And some patients do ask me because I'm in Seattle and they're in Seattle if we can meet.
Mhm.
Uh,
Right.
I think I'm because I worked here for a long time. A lot of my patients, they know me, and it was an easy transition. I
Yeah,
think since COVID, a lot of people got used to
absolutely.
having the telemedicine as a platform. And sometimes, yes, older people can find it a little challenging, but with technology and most of the platforms are so user friendly that most of the patients are able to do that. I had like a 95-year-old from New York.
Really? That's
he,
awesome.
he was like, I, of course, his daughter was also there with
Right.
him, but he was able to like, they were in different places, and so she kind of probably walked him through that, and he was able to talk to me. And he said, "I wish you were in New York. I'll come meet you." And I said, "It's all good. Look, I don't even have to be in New York, and
Right?
we can talk anytime." And so I think it is a great way to connect people. I mean, there are the physical boundaries have dissolved. Like I
Yeah,
can talk to people anywhere in US.
yeah.
So that is huge, of course, for the business,
I think you made
because
another good point too. So you mentioned that your patient was in New York, but their family members were where?
I think somewhere in like up, I don't know, I think Boston or
Right?
somewhere in East Coast, but not nowhere near here.
I think that's
Yeah,
amazing. That's very unique, right? And like
yeah,
so you could get the patient's family members together and they could be all across the United States,
that's
but
true.
still
Yeah,
treat them holistically as a family, which is great.
correct. Correct. Yes, and that's the other thing. I love the telemedicine part of it because we can connect people without straining people to be physically present in
Yeah.
one place. And I think it has gone pretty good so far now with the platforms we have nowadays. I mean, I can prescribe medications, both herbal and allopathic medications, to wherever their pharmacies are. There is a great network of labs, so those can all be done anywhere in US, and you just need to kind of enroll in some of these bigger groups. And it's almost like doing business in brick and mortar. So I don't
Yeah.
find it any different than that. And I think it's the quality, like you and I are talking, it just almost seems like we are together
Yeah.
in a room,
Like
right?
we're face to face.
I,
No,
I don't,
absolutely.
yeah, yeah, it's like face to face. So it's not the same. I don't think people feel like you need to be touching them all the time, or there is a value to that. Maybe when people are going through treatments and you want to examine them, and some of the things can be challenging when you're on the video. But for the most part, most of my patients have their own oncologist.
Mhm.
Either it's me or somebody else who they see on a routine basis, and this is more like a brainstorming session as
Yeah.
to how to help them go through what they are going through easily and mitigate their side effects. And I have some patients who have had high risk of cancer, or
Mhm.
they've had their cancer journeys completed and treatments completed, but they want to make some conscious choices in their lifestyle and want to take, supplements and things which may help prevent cancer from coming back, boost their immunity, help them improving their mitochondrial functioning level, all those things, help. And it's a different mindset,
Yeah.
but I think it adds so much value that I think my vision is I hope all the oncologists in the world would consider this for their patients.
Well, and that's a great segue because my next question is, well, what does a program look like? Right. I'm pretty ignorant about integrated medicine and what it does, but I'm looking at your website and there is, you have kind of three big categories of programs: a cancer prevention program, cancer survivorship, and an active cancer program. May sign up for this cancer prevention program by so watch out for my name. But what is integrative medicine and how does that play into cancer care? What can we expect if we look into these programs?
Yeah, each of these three pillars have a little bit different approach. When you're actively going through cancer, our approach is more towards making sure that you are able to complete your conventional Western protocols
Hmm.
appropriately, and you're not very bothered by the side effects. We are there to help you, like with diet. There are certain diets that are now shown to help people with having less chemotherapy side effects, like fasting mimicking diet. So we have these protocols. We have dietitian who would sit down with our patients, and they would guide them through what they should and should not eat prior to their cancer chemotherapy sessions. These are more tailored to each individual patient and where they are in their cancer treatment protocols, because we don't want people to starve
Yeah.
when they are getting treatments as well. So all these things are kind of weighed in very individually for each
Yeah.
patient. And that's a great where you being an oncologist can really help, because I know, okay, if somebody's going through a very intense treatment and they're going to not be able to eat for a week, what is the appropriate time of starting this diet, and in how much percentages of the drop in calorie intake we should be doing for these patients before the chemotherapy. And these people meet me more frequently, and it's a more intense program. I meet them sometimes weekly or every two
Mm.
weekly protocols, because I need to know how they're doing and if we need to make any adjustments based on where they are in their treatment journey. They meet with we have psychologists, and there are some trainers in the area who help with certain treatments, yoga and tai chi, and even basically other partners in the local area. And that's where I have to, when people are from other states, I need to know, I kind of try to figure out what's available in their area. And then our team would reach out to those people and say, this is our patient and we would like to work with you. And of course, they're getting business. So
Yeah.
they're
Yeah.
always happy. But, my hope is we'll grow more. I mean, we're just starting. So, and most of my patient base is in the Seattle area at this point, and slowly hope is we can move to other places.
Yeah. No, it sounds like a very powerful tool because is that really part, and when you were going through your hemonc residency, how much do they really pay attention to this? Right? It's
Not
probably
we
more
don't have
science,
time. There's
right?
no time. Healthcare in general is so stressed out. I mean, everybody in healthcare is
Right?
overworking, and there's no time when you are going through your oncology visit. Some places it's like every 15 minutes, and you're like, how can you do justice
Yeah.
in 15 minutes to what a patient is going through when they're going through such intensive treatments? And some bigger places have resources which they can say, okay, you can meet our psychiatrist or
Mhm,
psychologist, you
mhm.
can meet our nutritionist. But these people maybe meet with them once during
Yeah,
their whole treatment plan, and then they will write some plan, and they'll say, okay, then you can go to your oncologist and they can deal with it.
yeah.
And the oncologist just busy
Yeah, they
taking
don't
care of
want
like
to,
day to
right?
day.
Yeah,
They're like,
exactly.
okay, how do I get through this day and with one patient at a time. And you need to slow down. We need to slow down and take medicine. It should not be just an RVU based system. It should be quality based, and that's what patients deserve.
Well,
Yeah.
and that's what patients want too. I
Yeah.
think, especially in this realm, right? I've definitely dealt with a lot of patients that, come with complications from chemo or a new diagnosis of cancer. Unfortunately, I'm the one that's breaking the news. And these are a lot of questions they have. What can I
Mm.
do? What can I eat? How am I going to survive this? And these questions, obviously, I honestly can't answer. I just don't have the
Right.
training. And it's kind of eye-opening to realize that even when we send them to HEMONC, sometimes or a lot of times they don't have those answers. So,
Right.
and this is what they want and what they need. This is probably why you're seeing better survival rates or better outcomes with these patients because
Right.
they're involved in their care and they know that people care. No, this is amazing. And yeah, I'd love to see this grow further and further because I think, yeah, this is a very important part of cancer care or just care in general. And plus, I love the family or the reach out that you could connect family members so they could be a part of their care too. Coming from a big involved family, a lot of my
Right.
family members have had diagnoses of cancer. And it's a village out there, right? And a lot of times they're like, well, what's going on? And a lot of times their kids don't know what's going on and how to help. So bridging
Yeah.
that gap, I think, is huge. It's important. And I'd love to
Right.
see more of that. That's super awesome.
You're right. And I think cancer prevention is a area which is very close to my heart. I feel as a country, we are spending so much resources in finding cures or
Yeah,
treatments, and but nobody's paying attention to like how can we prevent this from happening. Like
yeah,
we have to be like doubling our efforts much more than what we are doing in the treatment aspects into prevention. We have to educate our people to eat right and
yeah, yeah.
exercise, or how much to work, and how to like meditate and how manage stress. I mean, we're just not told all these things. And just from basic, like even from childhood, like good lunches for your schools, like healthy lunches
Yeah.
for your schools, no sodas in your school, or
Oh,
all these things, these are so important. As a community, we are lacking big time.
I'm seriously thinking about signing up, but now I'm kind of embarrassed to talk to you. And being
Oh, no.
you're gonna uncover all my bad habits. You're talking about sodas and stress and exercise and rest. I'm like, "Oh, man, Jesus.
No, really. I
She's
mean, I
gonna tell me I'm
myself,
done."
yeah, no. So I thought I was a person who was at least doing healthy things.
Yeah,
When you see so much death in your life, a lot of my patients are end of life, and you want to make sure that you are doing the right thing. And I always thought I am eating organic
yeah,
food. I am
yeah,
trying to cut down my sugar. I don't drink much alcohol, coffee, tea, whatever,
yeah,
all those things. And I'm trying to be mindful. And but still there was this stress. As a physician, we
yeah.
are so stressed out. We're doing things, we are like running from morning to evening, and having your breakfast on the way in the car when you're
I'm
going to
so
work.
guilty of all
So,
those.
so you don't
Absolutely.
slow down, and that adds up. That
Yeah.
adds up. And
You're right. We spend so much focus on treating, but really, especially, you're talking to the physician population too. We're the worst. We're the
yeah,
worst just for the reasons you said. We're so good at treating others and taking care of others
right.
that we never really take care of ourselves. And a lot of what we talk about here on this podcast too is just wellness and mindset and really taking care of yourself, right? A lot of us have taken this journey or pivoted to this because we've realized that everything's not all about brick and mortar work, work, work. There is a room for that, yes. But, I think we need to, like you said, change our priorities, change our focus, and no, it's eye-opening, especially now I'm getting older, right? And reassessing my mortality. And a lot of things I just kind of poo-pooed and was like, whatever, I'll deal with that later is now coming to a head. And I'm like, oh, maybe I should deal with this now.
Yeah. It's eye opening that even little things can change our physiology so much.
Yeah.
It's amazing.
Let's say,
Yeah.
what is the top three things that you see often? in your patients and when you're talking about cancer prevention or really just any of the programs, what are the top 3 lifestyle modifications or treatments that you recommend?
Yeah, I think the first and foremost is what we put in our bodies.
Yeah,
Diet is
I'm
very,
horrible.
very, very number one thing. And it's just not like how much protein we eat
Yeah.
or carbs we eat. It's like what kind of foods they are, what is their source, how much preservatives are in them.
Oh, man.
And it's
Yeah,
just like how the society
yeah,
is, right? We have to kind of reinvent the wheels here, and we don't think about it because we
yeah.
are so busy. We're like, okay, I had a good amount of I had 60 grams of protein today. I think I had a good
Right.
amount of diet today. But it's not just that, and also how you consume your food is important. Are you sitting down? Are you kind of relaxed when you're eating? Are you calm when you're it's very important. Like, I went to Europe, and people are just sitting outside eating for 2 hours. They
How
book
do they
book
find
tables for
time to
2
do that?
And
You're
I'm like,
right.
"No, it's amazing." And I was so impressed. I'm like, "Look at that." Yes, we don't wanna waste time. I
Right,
understand.
right.
But even when we have time, we don't do that. We're,
No.
like, still in a rush. We'll fill our minds with other things. "Oh,
Yeah,
we have to read this book or do this
right.
podcast." We just want to make sure we make time for our meals and put effort in them. I think that's very important. And second is, of course, your body. Your
Yeah,
body is where everything is. So taking care of your body physically is important. Doing some kind of, exercise or physical activity every single day is very important.
yeah, yeah,
And as part of that, taking care of your body, not just feeding it and exercising, but also keeping it in a more central, calmer place, whether it's by doing breathing, whether it's with the different breathing techniques. People do these, box breathing, or there's so many other breathing techniques you can
yeah, yeah,
learn to do. Doing it like multiple times a day to kind of keep you, to reset you all throughout the day. I
yeah.
think that is very important. And I think the third thing is being mindful of our mortality is very important too. I feel that that keeps me grounded. Everybody is going to go, right? So we're
Yeah.
not here forever. So, which also brings the point that when we are here, are we doing, you know, what we are supposed to do? Utilizing your time wisely, because everything falls into place when you feel comfortable in your own mind that you are doing you're your best version. This is your best version, right? Not somebody else's, not what somebody else wants you to be. This is what you are, living your best life. And I feel that most of my patients have that regret when they
Yeah.
are diagnosed with cancer, that, oh, I did not do what I wanted to do.
It's funny just listening to this. I'm feeling a little regret too. Like, oh man, is this really the quality and the best life I've had? Working this much and prioritizing really the things I shouldn't necessarily prioritize, right? Did I focus on children? And it's just running through my head. I'm like, oh man, yeah, that's
Mhm.
tough.
It has become tough because of how our society has started unfolding and
Yeah.
how things unfold in front of him, and we just are, then we're just on this train, and this train is going in
Oh
that
yeah. Yeah.
direction. We need to just get out of this train and,
Yeah. And,
choose
and
another
really,
train. Yeah.
anytime you try to get off too, people are pulling you back on saying,
Oh,
"Hey, why aren't
absolutely.
you going on this train with us?" Right? And
Yes,
you feel
yes.
bad, you feel guilty, you feel like you're not doing the right thing when in fact you may actually be doing what's best for you, which is even tougher, right? Because you're
Right.
right. These norms that we
Yeah.
have and our expectations, it's tough. And just listening to this top 3, remembering how I throw my breakfast at my kids while we're driving and they're eating their breakfast in the car 15 minutes before I drop
Been
them
there.
off.
You're not
Man,
alone.
I need to change. Yeah, no, this is great. No, I think the service is amazing. Don't be surprised if my name pops up on your schedule. And yeah, because
I
absolutely, I think if the listeners out there, if you haven't really, closely looked into what you're doing and just kind of just what we've talked about, I think it's time to do so and just, investigate, hey, am I doing what I can be doing? It's not really how long you're right, but it's the quality of life, right? And, that's a great question to ask yourself. Now, we are getting close to time, but the last question I always ask people now is, hey, when you go back and talk to your intern self, let's say day one of your intern year, knowing what you know now and experiencing what you experienced, what would you tell your intern self on day one of your intern year?
I would tell myself not to worry so much. I think all throughout my residency and fellowship, I would worry. I was always anxious about how I was doing. And I think coming from another country, you always want to make sure that you are accepted, that you belong into a place. You overdo things, you're trying to make sure that you're the first one up on the floor, you're the last
Yeah.
one to leave, and you are there, and which helps. I think you become a good doctor by doing all that, but it does take a toll on your mind and body to worry so much. So I would tell my intern self, look at me, it's okay. Don't worry so much.
Right.
Things will fall into its places. And I have found that I belong here. I always belonged here.
Yeah,
And
absolutely.
I just should not have doubts, and also to believe in yourself,
Yeah.
which is very important.
No, that's amazing. I think the service you're offering is, I think, a powerful tool that everybody should be investigating. Check it out. It's Thrive Integrative Cancer Care.com, right? Do you have social handles too? How can they
I
find
do.
you on
I'm on Instagram and Facebook.
and on Instagram? What's your handle there?
I think it's a hashtag Thrive.
Okay.
Yeah.
Awesome. Check it out. And Nancy, thank you so much for joining us. If you have any questions, concerns, please drop us a line at info@telemedicinetalks.com. You could reach myself at leo@telemedicinetalks.com and Dr. Sharma at her website, the Thrive Integrative Cancer Care.com. Check it out. And you will probably be hearing from me pretty soon through that website
Mhm.
as well. Thank you so much for your
Yeah,
time, and it's awesome to see you doing this finally, because I know this is kind of what your main goals were when you started that, and, we started this journey together, so it's awesome to
I
see
know.
this
Yeah.
come to fruition. Congratulations.
Thank you so much, Leo. Thank you for
No
having me.
problem. Thanks for your time.
Thanks. Thanks.
And, yeah, see y'all later, Telemedicine Talks.